If you've ever heard people talk about a double dip with Social Security, it probably sounded a bit mysterious, almost like some hidden trick only insiders know. And that's exactly why this topic has gone viral across retirement forums, YouTube channels, and financial discussions in 2026. Because when it comes to Social Security, SSA, Medicare, SSI, and SSDI, even a small misunderstanding can change how much money ends up in your pocket every single month. Now imagine this. Two people with almost the same work history retire at the same age, but one receives significantly more benefits than the other, just because they understood how these systems can interact. That difference is what people are calling the double dip strategy. But is it real? Is it legal? Or is it just another internet myth wrapped in excitement and confusion? Today, we're breaking it all down in simple, clear language so you can understand what's actually possible in 2026 and what could potentially help you or someone in your family maximize retirement income without breaking any rules. By the end of this video, you'll understand how Social Security benefits really work together with Medicare, SSI, and SSDI, what people actually mean when they say double dip, and most importantly, how retirees may be able to structure their benefits in smarter ways depending on their situation. We'll also clear up the biggest misconceptions that lead people to make costly mistakes when filing for benefits too early or without proper planning. Let's get into it. When people hear the phrase double dip, it sounds like getting paid twice for the same thing. And that's where the confusion begins. The Social Security system in the United States does not simply allow unlimited stacking of benefits. Instead, it is a carefully designed structure with multiple programs that sometimes overlap in specific legal ways. SSA retirement benefits, SSDI disability benefits, SSI supplemental income, and Medicare health coverage all serve different purposes. But under certain conditions, they can interact in ways that increase total support for a beneficiary. The first thing to understand is that Social Security retirement benefits are based on your lifetime earnings and the age at which you choose to claim. The earlier you claim, the lower your monthly payment tends to be. The later you delay, up to a certain age, the higher your benefit can grow. This simple rule alone is where many people unintentionally reduce their lifetime income. But the strategy people talk about often starts here: timing. Now let's bring in SSDI, or Social Security Disability Insurance. SSDI is not retirement income. It is support for individuals who are unable to work due to a qualifying disability. However, what many people don't realize is that SSDI can later convert into regular retirement benefits once a person reaches full retirement age. This transition is automatic, and the payment amount generally remains the same. This is one reason some people refer to it as a kind of double usage of the system over time, even though it is technically one continuous benefit path. Then there is SSI, Supplemental Security Income. SSI is completely different because it is needs-based, not work-based. It supports individuals with very low income and limited resources, including some seniors and disabled individuals. SSI can sometimes exist alongside other benefits, but it is reduced depending on how much income a person receives from SSA retirement or SSDI. This interaction is important because many people mistakenly assume SSI can be fully stacked with other benefits, when in reality, it is carefully adjusted. Now Medicare enters the picture. Medicare is the health insurance program linked to Social Security eligibility. Most people qualify at age 65 or earlier if they have certain disabilities. Medicare itself does not directly increase cash income, but it reduces healthcare costs significantly, which effectively increases financial flexibility. When people talk about double dipping, they sometimes include Medicare savings as part of the overall benefit picture, because lower medical expenses can feel like higher income in practice. So where does the double dip strategy idea actually come from? In most cases, it comes from combining or optimizing different legitimate elements of the system rather than actually receiving two full payments for the same benefit. One example is married couples coordinating their claiming strategies. In some situations, one spouse may claim spousal benefits while also delaying their own retirement benefit to grow larger over time. Another example is individuals who qualify for both SSDI and later transition into retirement benefits without a reduction in their payment amount. And in some cases, low-income retirees may receive SSI supplements alongside partial Social Security benefits, depending on eligibility rules. But here's the key point that must be understood clearly. There is no loophole that allows unlimited double payments. Everything within SSA, SSI, SSDI, and Medicare is governed by strict federal rules. What exists instead are timing strategies, eligibility overlaps, and coordination opportunities that can sometimes improve overall financial outcomes when used correctly. In 2026, one of the most important topics affecting all of this is cost of living adjustments, often called COLA increases. These adjustments are designed to help benefits keep up with inflation. When COLA rises, monthly payments for Social Security and related programs may increase, but this is not a bonus. It is an adjustment to maintain purchasing power. Still, it plays a major role in how retirees plan their income. Another critical factor is the age at which benefits are claimed. Many retirees still claim Social Security at 62, which is the earliest eligibility age. However, claiming early can permanently reduce monthly payments compared to waiting until full retirement age or even age 70. This decision alone can create thousands of dollars in difference per year. So when people talk about strategies, this timing decision is usually the most powerful one. Now let's talk about a common misunderstanding that fuels the double dip myth. Some people believe they can receive full SSDI and full retirement benefits at the same time. This is not correct. SSDI converts into retirement benefits once full retirement age is reached. There is no duplication of full payments. However, during the transition period, individuals may experience structured adjustments that can appear confusing from the outside. Another misunderstanding involves SSI stacking. SSI is always adjusted based on other income sources. So while it can provide essential support, it is not an additional full payment on top of Social Security retirement or disability benefits. It fills gaps rather than duplicates income. So why does this double dip idea keep spreading? Because the Social Security system is complex, and when people see multiple programs interacting, retirement benefits, disability benefits, supplemental income, and healthcare coverage, it can look like multiple income streams are stacking together. In reality, it is more about coordination than duplication. Still, understanding this coordination is extremely important. Many retirees lose money not because they are ineligible, but because they claim at the wrong time, misunderstand spousal benefits, or fail to consider how working after retirement can affect their payments. In some cases, earnings after early retirement can temporarily reduce benefits due to income limits, which adds another layer of complexity. What smart retirees do instead is focus on planning. They look at their expected lifespan, health condition, work history, spouse eligibility, and income needs. Then they decide when to claim, how to combine benefits legally, and how to coordinate Medicare enrollment to avoid penalties. These are the real-world strategies behind what people casually call double dipping. And here is something very important for 2026. Policy updates, inflation adjustments, and administrative changes continue to shape how these programs behave. While core rules remain stable, yearly updates can affect benefit amounts and eligibility thresholds. That is why staying informed matters more than ever. At the end of the day, Social Security is not a loophole system. It is a structured support system designed to provide stability during retirement, disability, or financial hardship. But within that structure, informed decisions can make a meaningful difference in monthly income and long-term financial security. So if you've been wondering whether the double dip strategy is a secret trick, the truth is simpler. It's not about breaking rules or getting extra hidden payments. It is about understanding how SSA, SSDI, SSI, and Medicare interact and making smarter, well-timed decisions based on your personal situation. Now, before we wrap up, let's make sure you don't miss future updates like this, because changes in Social Security rules, Medicare adjustments, and retirement planning strategies can directly impact your financial future. Staying informed is one of the most powerful tools you have. If you found this breakdown helpful, take a second to like the video. It really helps support content like this. And if you want more clear, simple explanations of Social Security, SSI, SSDI, and Medicare updates, make sure to subscribe and turn on notifications so you don't miss the next update. Also, drop a comment below and tell us, did you think the double dip was a real loophole before watching this video? I'd love to hear your thoughts.